Stay tuned for valuable insights and practical tips to help you safeguard your kidneys and live healthier lives. Understanding chronic kidney disease. Chronic kidney disease, CKD, is a progressive condition in which the kidneys gradually lose their ability to function correctly over time. Unlike acute kidney injury, which occurs suddenly and is often reversible, CKD is a long-term condition that can lead to permanent damage if left untreated. This can result in a buildup of waste and fluid in the body, leading to various complications and impacting overall health. Several risk factors contribute to the development of CKD, including diabetes, high blood pressure, obesity, smoking, and a family history of kidney disease. Additionally, specific ethnicities, such as African Americans, Hispanics, and Native Americans, are at a higher risk of developing CKD. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. Early detection and management of CKD are crucial in slowing down the progression of the disease and reducing the risk of complications. Regular screenings, monitoring blood pressure and blood sugar levels, maintaining a healthy lifestyle, and following a kidney-friendly diet can all play a significant role in managing CKD effectively. By understanding the basics of chronic kidney disease, recognizing the associated risk factors, and prioritizing early detection and management, we can take proactive steps to protect our kidney health and overall well-being. Stay tuned for more valuable insights on navigating the complexities of CKD and leading a healthier life. Identifying kidney failure symptoms. Recognizing the early warning signs of kidney failure is crucial for timely intervention and management. Common symptoms of kidney failure include fatigue, swelling in the legs, ankles, or feet, edema, changes in urine output, either increased or decreased, nausea, and difficulty concentrating. These symptoms can indicate that the kidneys are not functioning optimally and may be struggling to filter waste and excess fluids from the body. Fatigue is often a prominent symptom of kidney failure due to the buildup of toxins in the bloodstream, leading to a feeling of constant tiredness. Swelling, or edema, occurs when the kidneys cannot regulate fluid balance effectively, resulting in fluid retention in the body's tissues. Changes in urine output, such as increased frequency or decreased volume, can signal kidney dysfunction and impaired filtration. Nausea and difficulty concentrating may also be present due to the body's inability to eliminate waste products properly. If you are experiencing any of these symptoms, it's essential to consult a healthcare professional promptly. Early detection and treatment of kidney failure can help prevent further damage and improve outcomes. Pay attention to the signs your body is giving you, take action, and prioritize your kidney health. Exploring kidney transplant. Kidney transplant is a life-saving treatment option for individuals with end-stage kidney failure, offering a chance for improved quality of life and long-term survival. During a kidney transplant, a healthy kidney from a living or deceased donor is surgically implanted into the recipient's body, taking over the function of the failed kidneys. This procedure allows the recipient to regain kidney function and avoid dialysis. The benefits of kidney transplantation are numerous, including improved quality of life, increased energy levels, better overall health, and the ability to resume a more typical lifestyle. Compared to dialysis, kidney transplant is associated with lower mortality rates and fewer complications, making it the preferred treatment option for many individuals with kidney failure. To be considered a candidate for a kidney transplant, individuals must undergo a thorough evaluation process to assess their overall health, compatibility with potential donors, and ability to adhere to post-transplant care requirements. Factors such as age, medical history, and lifestyle habits are considered when determining eligibility for transplantation. Post-transplant care and monitoring are essential for the long-term success of the transplant. This includes taking immunosuppressant medications to prevent rejection, attending regular follow-up appointments, monitoring kidney function, and making lifestyle modifications to support kidney health. By prioritizing post-transplant care, recipients can maximize the longevity of their transplanted kidneys and enjoy a better quality of life.